Welcome to AI in Action, Exploring Tomorrow's Tech Today, the podcast where we delve into the groundbreaking world of artificial intelligence. I'm Mari, and with me is my husband, Jim. With our combined expertise in technology and education, we're here to guide you through the AI revolution. Whether it's the latest news headlines or transformative AI applications in classrooms, healthcare, and beyond, we're here to make sense of it all. Together, let's uncover how AI is reshaping our world from everyday encounters to the future of work. So let's dive in and explore tomorrow's tech today. Today, we're going to spend some time talking about artificial intelligence and what it is doing in the medical industry. The reason that we're doing this is, first of all, we had a listener that specifically asked when we were going to cover the medical industry. And secondly, because it's kind of personal.
Yeah, when you mentioned to me about looking into AI and medical, I started thinking about our family, and we have a lot of connections, either directly or indirectly, in the medical field that I hadn't really thought about in a long time. For example, you used to work in the medical field.
Yes, I actually started out in a nursing home when I was 15 years old. It was one of my very first jobs. Became a CNA, which is a certified nurse assistant, and spent lots of hours taking care of our elderly population.
And then I think you also were an EMT.
Yes, actually. I did get my EMT license when we went off to college, and I worked right out of high school. I went to work for a neurologist in Austin, Texas. And then I also worked for Scott and White, Baylor Scott and White now in College Station area as administrative secretary and a nurse assistant for a doctor in Bryan College Station. So I have a lot of experience in the medical industry.
Don't forget medical billing.
Oh my gosh. I actually had a medical billing company that I started in Austin after I stopped working for the neurologist because I realized that one of the major pain points for that office was their medical billing. You had to figure out, what was the ICD-9 and what was the CPT. Now, this is old acronyms, like in the 90s. It might have changed, but the length of visit, what was the best diagnosis to get the most from the insurance company, what was going to be denied, what wasn't going to be denied. It was a lot of paperwork. So I did have a medical billing company for quite some time.
And even today, when we start talking about medical billing or we start filing our own insurance and things like that, all of that experience was certainly helpful for you to fill out paperwork today. We also, our oldest son,
he's a paramedic. Very proud of him. He took my EMT and took it a big step further.
And then our daughter,
she actually is a computer scientist from University of Texas is where she got her degree, but she got a minor, or they call it like a certification. Basically, it's a minor in the business of healthcare. So she did a lot of research about, the different laws in healthcare and just like the business dealings with the healthcare industry.
So it certainly, when you asked me to look into this stuff, it was certainly made me think about all the ways that we've been involved. And of course, our parents are getting up there in years, and you spend a lot of time helping them with their medical problems. It is astonishingly complicated for our parents.
Just the number of medications and prescriptions and what they take in the morning, what they take in the afternoons. It is very, very common, especially for them, which is why they have to have me or an advocate to do things for them.
So in the process of doing all this, I also discovered something interesting about myself. This is probably not going to surprise you, but I'm actually terrible as a patient.
Oh,
I don't do well when I go to the doctor's office because I sit there very quietly. What was the term you used the other day? White coat syndrome or something like that?
It is a thing. It is absolutely a thing for someone to have what we call white coat syndrome. You go in, you have all this stuff in your mind that you want to talk to your doctor about. You know exactly what you're going to say. You sit down and it just goes. It's just not there anymore. And then
it's a thing. It's a
believe
thing.
it or not, as soon as you get in your car after you've left the doctor's office, you go, oh man, I should have asked, and I was going to ask this or I was going to ask that.
Well, since it happens to me every time I go to the doctor, I certainly believe you. So even though I know this is a bad idea, and I'm sure anyone would tell me it's a bad idea, I decided to try something different as part of this experiment. And I got onto ChatGPT, I call it the Oracle, and I started having a conversation because I've had some issues where I've what I call heart flutters, where I've had some issues with that feels kind of weird. And, I wore the Holter monitor and I did all the things, but I have a difficult time describing the symptoms. So I sat down and had an interactive discussion with the Oracle about what I felt and when I felt it, and asked, kind of got an interactive conversation. Now, I would never tell someone that this is a substitute for a doctor, and I didn't believe that. I actually used it, I think, maybe differently than most people do. It was an archiving method. So basically, I copy pasted it and emailed it to you. And so I know, because I'm like a 12-year-old. When I go to the doctor, you're generally with me because you don't trust me to actually tell the doctor what's wrong. So now we have sort of this interactive conversation that I've had with the Oracle. Now, a warning to everyone out there: if you've gone to the doctor before, and I'm an engineer and I went to the doctor once and I had maps, graphs, and charts that I built as to what my symptoms were and overlapping them with food and all, when I ate and all this other stuff. And doctors don't tend to want to see quite that much data on the first visit. So they want to give you some input.
There are some doctors that do. One of the
Yeah.
things I admired the most about Dr. Robert Kane, who was a neurologist that I worked for, the very first doctor I worked for, is he would sit down with the patient and then the patient would start telling him all the symptoms and everything. And if he did not know, if he like, I am lost, he was the first one to go grab the book at the time
Mm-hmm.
off the shelf and
Yeah.
start looking up stuff. So there are a lot of doctors out there that are willing to listen and to help you explore the possibilities of what things might be.
So I now have sort of a template that I'm using whenever I'm going to go to the doctor, and I need to have a better conversation that I can give to you, obviously, so you can make sure that I do. But it was an interesting experience. I really didn't think it would be that useful, and it didn't start out that way. But I realized after I'd done it that, hey, this might actually be a useful thing for us to take, because I have white coat syndrome, as
White
you
coat
called it.
syndrome.
Okay.
It is a
Anyway.
thing. So let's talk about some headlines. Some of the things that, whenever I asked you to do some research on this, one of the things that really caught my attention, because again, I have personal experience with this, is the it's a ultrasound. It's basically, it's an AI driven portable 3D breast ultrasound scanner. Now, a lot of females out there, once you hit a certain age, you're supposed to go for that annual mammogram. Chances are you get your mammogram. They say, whoop, we found something. Gonna have to come back in 2 weeks. So, what do you do for the 2 weeks? You stress about it. And what do? They bring you back and they do an ultrasound.
Which is amazing to me when you think about it. So you go and you get a test, which is very uncomfortable, I understand. You get the test done, you get the results back. If they find anything, they send you for an ultrasound. Why don't we just start with an ultrasound?
Oh, and then if the ultrasound comes back abnormal, then they send you on for another test and another test. And so it is very, very stressful. Well, what this is, and it's still in the beginning phases of it, it's a company called Isona, ISONA. It's a portable ultrasound scan that you do at home. And it's really great for someone who actually has had something, who has had cancer and it's no longer, they're in remission. It's a way that you can get psychological comfort from being able to do this. It's accurate, it's fast, it has a remote monitoring so you can do it at home and then your doctor can actually see it.
Okay,
So
you're not selling this.
I'm sorry,
So
but I
you're
I
excited about it. I
think
get
that
it.
this
I
is
get it.
very groundbreaking for
I hope so.
females.
I hope you're correct.
Yes.
Now, we did skip one that was personal to me. You had a medical condition years ago, and you had
Pulmonary embolisms.
pulmonary embolism.
Yes,
Sorry.
both of my lungs, pulmonary
And
embolisms.
during that time, I spent a great deal of time laying awake at night listening to you breathe. And this is a piece of hardware. It's not AI driven yet, but it will be. But it uses a type of radar. And apparently, they say they can detect you breathing from 30 feet away, which is kind of interesting. So I'm
Think
kind of,
about what this would do for the new parent. When we had our first child,
I
I
remember
slept in the room next to the crib
we had the
because
little baby
I was
monitor.
terrified
Yeah.
of Jacob stopping to breathe because you always hear all of these absolutely horrible.
Yes, crib death, I think is what they
Yes,
called
yes,
it,
and
which
it's
was
horrible.
terrifying
So
for new
if this
parents.
device actually listens and monitors, and it can do it within 30 feet, again, that's another just
You feed that,
comfort.
you feed all that to an AI, and what do you got? So what do we have next?
So next, we're talking about still talking about breathing. A doctor, you go in to see a doctor, and they always listen to your lungs, and they've been trained to listen for certain things. It has to do with like when things are the membrane of the lungs when you're breathing in and out. And sometimes if you have pneumonia, it sounds a certain way. If you have an infection, it might sound a certain way. For me, when my lung was collapsed, it was a certain way. So all of this stuff for asthma,
Which,
inflammation, just all of these scenarios.
yeah,
And doctors have been trained to hear or listen for these scenarios. Well, the problem that you run into is that doctors, they might hold the stethoscope different ways. There might be background noise in the room that they're listening. Their stethoscope might not be as good as another doctor's stethoscope. So they're always getting different diagnoses. They're missing diagnoses sometimes. One doctor will say it's one thing, and another doctor will say it's something else. So this, what they've done is they've taken and they've recorded. It was at a university hospital in Geneva, and they took and they uploaded all the different
they
sounds.
train the AI.
They trained the AI on
They did.
all of these different sounds. And now they have a device that is called Deep Breath that actually uses the AI to identify what the respiratory issue might be.
And remember, we're not saying this is going to replace doctors. This is just using an AI as a sophisticated tool. And again, from a personal perspective, I've developed asthma as I've gotten older, just mildly, but which is usually something I'm allergic to or something that kind of triggers it. But having a tool like this to help or to give you that peace of mind, or a doctor to do a better job of being able to diagnose, or a quicker job, is nice. So, what else we got?
The next one that we thought was really cool was the brain cancer treatment. So basically, there's been a study that shows that there's a promise for treating brain cancer. Now,
This is
what
an
this
AI
is,
tool, by the
it,
way.
it is an AI tool. It's called Charm, is what they're calling it. Basically, what
Stands
it
for, oh,
does,
here we go. What does this stand
it
for?
stands for
Cry.
Cryosection Histopathology Assessment and Review Machine.
Wow.
Say that
No
fast
wonder
four
they call it
times.
charm.
So it's called Charm. And what it is it's something that's going to quickly pick out the genetic profile of a tumor, specifically a tumor called
Glioblastoma. That's my best
glioblastoma.
effort.
Now, if you get a glioblastoma, hope I'm not totally massacring that pronunciation, you have 6 months. If it goes untreated, you basically have 6 months. Only 17% of the people with it are going to survive into their second year after they've been diagnosed, if they're getting treatment. And there's a very, very, very detailed operation that they do. Now, what the AI can do, according to this article, is it can tell if the malignant tumor, it can tell the difference in the malignant tumor cells versus the non-malignant tumor cells, so that when the surgeon is doing the operation with
That's
this
cool.
tool, it's allowing them to get all of the tumor.
Well, unfortunately, I think we know a couple of people who have
Yes.
possibly died from this particular thing, and it's horrible how fast it moves. So, I hope this AI becomes commonplace.
Yes. So the next thing is the uh, Microsoft, Google, and it's in the Wall Street Journal. This is an article about all of the information that is getting put in books. Well, not books, in your AI. It's all the books. All the information that is out there is now getting put into AI, and there's a huge race to see who's going to get the training done the quickest, so that you can then use Microsoft, Google, all of the big guys to search for information.
Well, and you think about it. I mean, AIs have been a part of this for a while. Google has one called MedPalm too, which I've read about recently. They've been doing tests, I think, at the Mayo Clinic. Um, Obviously, they have a financial reason for wanting to do this, but I like to think that the people that work there are like us. They want to see these AIs used for a good purpose, and in the medical world, especially, getting good data to people that need it, that's accurate and things like that is just incredibly important. So I'm glad to see that Microsoft and Google are both doing this. I hope they're successful. So
Yes, Microsoft and OpenAI both released a paper in March that said that the algorithms like the ChatGPT 4, um, they were going to be able to harness and provide information, communication, screenings, and decision support to underserved regions as well as non-underserved
I'd like to think
regions.
we may live in an I mean, I know we're in a first world country, but in
Rural
rural
America.
areas, rural America, it's really difficult to get some of the medical care, I mean, that you can get in other places. So
Yes, it is.
anyway, what do we got next?
So this one was one that a little upsetting. It was actually a article about AI, medicine, and women. So this one was very specific about AI and women's health and how it was going to affect women's health.
It was interesting because it is behind a paywall, so we can't really tell you a lot about it. But what's interesting to me was, as Mari had asked me to look into what AI is doing and where it is, there was so much information, it was almost overwhelming. Except I couldn't find a lot that was specifically about women's health. And I've read for many years, and I've seen examples myself of the issues that women have with getting, health care that's specifically, targeted toward women. So
One of the
it
reasons
was,
our daughter got a certification in the
yes.
business of healthcare is because of the underserved women in the healthcare industry.
Yes.
So, next. This one I thought was another one that's really cool. It is called a Nico body scan. So, one of the founders of Spotify, actually,
Is this his?
yes, this is his.
Oh, this was cool. I didn't actually read this one very
Yes,
closely. You were
it is a
telling me about
body
this.
scan. What they have done is they've come out with a scanning system that's non-invasive. It's a state-of-the-art system. There's a very sleek consumer experience. It's very affordable. There's 70 sensors. It takes 10 minutes for it to scan. And then it will basically give you a picture of your health. It's in Stockholm and they're getting funded. They're going to expand across Europe.
Hopefully to the United States, because I love the idea of getting scanned instead of getting poked and prodded in blood. I don't like holes in me, so the blood
Yes.
thing, blood drawing.
So they're saying that you're going to see smart clinics and smart hospitals and just things with early diagnostics. So it is automated. It's going to spot early signs of things. It's going to detect abnormalities that you might have,
Of course,
disease prevention.
since it's in Europe, I'm sure they're thinking a lot about privacy, because obviously, if you go in for multiple scans, the AI can learn a lot about you and then use that as a sort of a benchmark to determine whether or not something has changed in a bad way or
Mm-hmm.
maybe in a good way, depending on what they're looking for. But obviously, that opens up a lot of privacy issues, especially in a country that has so many insurance companies like we do, which would love to get a hold of data so they could make sure they didn't insure you if something changed.
Yes. One of the things that talks about is the challenge of reducing healthcare costs for aging population. It is already in Sweden. They're expanding it over, all over Europe, but the US, we don't know about that yet. So
Hopefully
hopefully it will
it'll
get
get it.
here.
We hope so, especially in these
Hopefully.
rural areas. Again, I'd love to see this at every, if CVS is listening, we'd love to see this at CVS and Walgreens. I realized that Elizabeth Holmes was a bad thing for you guys, but come back to it.
Well, this was on July the 11th, so it wasn't too long ago. It's a great article. It's a thing called AI supremacy. AI health scans are going to become the norm, is what it is called. Now, let's go on to the next one, which is about a paralyzed man that is now walking
I had to
again.
include this one.
because of artificial intelligence. Now, this gentleman had a motorcycle accident and he was paralyzed from the waist down. That happened about 2011. And he has been going through being able to walk again. The first thing they did is they did an implant, and he was able to use the implant to be able to take steps, but it was not AI driven. It was computer driven, but he had to like issue the command to the computer physically. And so it was very difficult for him to have any natural steps using that. Well, what they have done now is the University of Texas in Austin did a ML, or machine learning
There you go.
powered thought decoder.
That's a weird sentence, isn't it?
Yes.
Machine learning powered thought decoder. Think about what that says.
And
for
it
a
has
minute.
linked this gentleman's brain directly to the implant. So now he just has to think about the act of walking, and it sends the command to the implant and allows him to walk.
I got to admit, that's pretty cool.
That is very cool.
That is very cool.
So now let's talk about cancer.
This one caught my attention because it's called Cancer GPT. So it's in Decrypt, which is one of the news feeds that I get. I think it's a newsletter I actually get. But anything called Cancer GPT obviously is going to catch your attention.
So what it's doing is it is predicting how different drug combinations might affect rare human tissues found in cancer patients. It's a new approach. And it's representing a major progress in the field of medical research.
There's
So again,
University of Texas again.
University of Texas and the University of Massachusetts, they're using large language models, and they're going to extend prior knowledge from, notice I said extend prior knowledge. So they're training it. They're extracting knowledge that's already there from medical research and then applying it for reference.
Which is a typical thing. If you want a chatbot to get better, then you train it on your specific data. And instead of it on general train for all data, you take the large language models and start them as a base, and then you fine tune them. You use, embeddings. You do lots of different things, but you want it to be more accurate. So you give it more data that's domain specific, and that's what they're doing here. At least that's what it looks like to me.
Very interesting read. If you want to do this, again, it's with Decrypt. Meet Cancer GPT. Very interesting.
What do we got next?
Drug discovery.
I actually subscribe to McKinsey & Company. I don't know a lot about them, but they really have some cool articles I like reading. So it's another one of the gazillion different things that I subscribe to. They actually put this out last year, but in November of last year. But it caught my attention because not only does it have cool graphics, but it talks about what artificial intelligence, their prediction as to what it's going to do in the medical industry. And of course, some of the predictions may not come true, but it's really, really a good read. We won't go through it step by step, but it's a good read because they're trying to predict that, we talked about some of it already, personalized medicine and cancer treatments and drug discoveries. And this one specifically was focused on drug discoveries. I think I read recently that somebody had just submitted the first drug that was found by an AI. I think I read that recently.
The drug formula
was something. It was something
was suggested by an AI.
I need to look at that.
Let's think about this for a second. If I have a drug that's specifically, and I know the formula because drugs are chemicals. If I know the formula for a drug that's meant to treat something specific, and then I have the formula for a drug that's treating something else, and I ask an AI how those two could be combined to treat something totally separate.
Mm-hmm.
I mean, it's a very complex machine. It should be able to do that.
You could also say, ask it to speculate, based on this cures this, speculate as to what might also do it. So that maybe they could find alternatives when you start talking about antibiotics and things, getting resistance to antibiotics.
One of the things I found about this article that was interesting is it said that a new concept of a drug, 10 years. 10 years is what it normally takes to get a drug.
And that's if they get lucky.
And that's if they get, yes. But with AI doing a lot of the heavy lifting for them, they could cut that by a tenth.
Wow, that is amazing.
So
what's next?
Biggest burden.
Well, I don't know that I agree with everything in all these different articles, but it was interesting because I told you the personal things. I was obviously you're aware of them, but I talked to our paramedic son the other day, and I said, if you had an AI, an assistant that could do anything for you, what would you want it to do? And his answer, paperwork,
Yes.
administrative overhead. The same thing we talked about earlier when, you and I were fortunate enough, even in our small town, we have it's kind of, I think they call them concierge doctors, but we had a doctor who left Scott and White and started his own clinic, and you pay a monthly fee and you get to go see him. One of the things I love about going to the doctor is when I walk in the door, first of all, they know me. Second of all, there's no paperwork to fill out.
Mm-hmm.
You used to go with me, which I know sounds pathetic, but you used to go with me just to fill out the paperwork because there's like 15 pages of stuff. And this was every time I visited the doctor. It was insane. So when you start talking about that, and again, we talked to Rachel, our daughter, who got the degree, though the minor in business of healthcare, and she talks about WHO, which is the World Health Organization, and their ratings of different medical facility, different medical things around the world, and the United States doesn't rate very high. And one of the reasons that's listed very highly as to reason why the United States doesn't go as high is because the cost, the administrative cost of healthcare in the United States is so high. And a lot of that has to do with all the insurance companies. And anyway, I talked to Rachel a lot about that, and we've talked a lot over the years. And when you start talking about these AI's ability to help with that, I think it'll make. I think it's going to help with medical malpractice problems. I mean,
Yes.
Doctors are so busy filling out paperwork, it's hard for them to focus on their patients. So.
Well, something I know our paramedic son has a problem with is if he works in a very busy city. And so when he's on a shift, say he's on a 24-hour shift, he might go on an average of a call per hour. But then he has to stay and get all the paperwork filled out. So that first call that was 24 hours previous to when he's actually filling out the paperwork, it's difficult for him to really capture all of the details that he might have needed to capture. Something else, they just had a news report with a doctor where they were talking about it's not going to take the doctors out of medicine.
Oh, absolutely not.
It's going to actually allow the doctors to spend more time
with
being a doctor and with the actual patient. Last time I was at the doctor's office with your father, the doctor had to pause, go to the computer, look something else up. Then he would have to pause and he would go and he was like dictating his notes into a microphone on his computer while he was seeing the patient. So just think what it could free up for their time if they didn't have to do all of that
administrative overhead. It is the bane of existence for most people.
Yes. There is a book called The AI Revolution in Medicine that is about ChatGPT 4 and beyond. It is on Amazon. Again, the name of the book is The AI Revolution in Medicine, that I have not had a chance to read. I am planning on purchasing it. I am planning on reading it, but I have heard that it is a good read. I know that they talk about a day in the life of a doctor with a true AI assistant, like what it could actually look like, how an AI can enhance doctor-patient encounters at the bedside, which is what we were just talking about, right. How it can empower patients.
Just an example of it, of course, it's crude nowadays compared to what it could be eventually, but my conversation with ChatGPT 4, which was what this book is about, it was good for me. I'm not saying I'm going to replace a doctor with it, but it felt empowering because I learned something that would have been difficult. I don't want to just Google it. Right. I want to know more.
Well, and when you go in to see your doctor, it's going to empower you with more information so that maybe your doctor doesn't spend time trying to pull a thread that might not be the thread he needs to pull.
Or get information out of a patient who's terrible at describing it.
Cutting waste, uncovering fraud, streamlining reimbursements, and lowering costs. Those are some of the things that are covered in the book. Clinical trials, like I just said, taking that drug trial and making it be a lot less time to get it to market. And just the possible futures.
Yeah, it has a whole section in the book. That's what caught my attention about it was all the different possibilities. I love reading books about the positive things that can happen, because I unfortunately we hear mostly about the negative.
That
So
is
I
right.
enjoy the positive as well.
So we have just touched on, unfortunately, the things that caught our attention. There
Yeah.
is so much more information out there about what AI is going to do to revolutionize medicine that we could possibly, and we might come back in a few weeks, a few months, and do another podcast with some more medical information. But until then, we hope you guys come back and keep listening.
If you have questions, this episode was because someone asked. If you have a question you'd like us to look into, let us know.
And that brings us to the end of AI in Action, Exploring Tomorrow's Tech Today. We're Mari and Jim, your guides on this exciting journey through the world of artificial intelligence. We hope today's conversation has left you with fresh insights and a deeper understanding of how AI is shaping our future. If you enjoyed our discussion and want to stay up to date with the latest in AI, make sure to subscribe and share the podcast with your friends and colleagues. Remember, the future is not something that just happens to us. It's something we can actively shape and influence with knowledge and action. So let's continue exploring, innovating, and taking action. Thank you for joining us today. We look forward to sharing more exciting AI developments with you next time on AI in Action, Exploring Tomorrow's Tech Today.